So I think we're going to get started and allow people to just join in as they're able to. I know everyone has very busy schedules and clinical responsibilities. So thank you so much for making the time to join us today as we review our new clinical placement evaluation tool, which we have an endearing name for, PEPAA, which stands for the Physiotherapy Entrustable Professional Activity Assessments. So we're going to go through together today what these new assessments look like, what they are, and how you access them. So this is also a session where you can ask questions. If there's anything that you're wondering about or things you're not sure about, this is a great time for you to ask us some questions and reach out. So I'm going to start by just indicating to you what the expectations are for the clinical placements in the 2023-2024 academic year in terms of placement evaluation. Many of you will be familiar with the ACP, or the Assessment of Clinical Performance. It's the tool that we have been using both at midterm and finals so far for evaluation of clinical placements. So many of you are already familiar with that and have been logging into HSPNet to complete that midterm and final evaluation. As we go through a validation process of our new physiotherapy assessment tool, we are going to be continuing with the ACP, but we've eliminated that midterm evaluation point and are just completing a final evaluation of the ACP during clinical placements. In addition to the final ACP, we are now introducing something called, as I mentioned, the Physiotherapy Entrustable Professional Activities Assessments, or PEPAAs. And we're going to go through together in detail what those look like. So the first thing we'll review are what are EPAs. So the foundation of these new assessments are things called EPAs, or Entrustable Professional Activities. So what are those, and why are they relevant for physiotherapy? Our program has come up with 10 specific EPAs for the program, and they are really the nuts and bolts of what you do as a physiotherapist in your day. So they're very clinically relevant tasks or responsibilities, which you're going to have a student do and perform during the clinical placement. And the entrustable part is how independently can they complete those EPAs, or those tasks that you're having them do. And once they've demonstrated sufficient competence with them, we hope that you will entrust them to complete those activities independently. They aren't an alternative to competencies, but they're really very clinically focused and very practical ways to evaluate competencies and groups of competencies together while on clinical placement with you. So it might be that we have a whole bunch of competencies together that a student would need to be able to perform well to actually be able to do this EPA independently, or this entrustable professional activity independently. Why are we doing this? Why are we changing? And everyone balks a little bit at change. We're hoping that what we've created is something that's actually much easier for you as a clinician to observe in your clinical placement. So the EPAs really are much closer linked to observable behaviors in practice. So we're hoping that that makes it a lot easier for you to give feedback and do this evaluation of students on placement, that it's a little bit less abstract. The expectation with the EPAs, which we'll get into in a moment, is that they're very quick evaluations, but we do them with higher degree of frequency during the placements. And that more frequent feedback we know can be very helpful with students' development on placement. You're already doing a lot of this. You're giving that verbal feedback to students along the way. What we're doing now with these EPAs is just capturing that information that you're already providing to students and making that a substantive portion of the evaluation of the placement. We're really trying to move away from lengthy midterm and final evaluations and get those smaller chunks of feedback out to students frequently so that they can affect change based on the feedback you've provided to them. As you may have learned from our last session that we offered, the Queen's Physiotherapy program is moving to a competency-based education model. And so this method of evaluating students also aligns very well with the competency profile. That forms the foundation of our PT academic program, and our EPAs really align with that as well. So that you may be familiar with the essential competency profile for physiotherapists in Canada. our program, and now our evaluation of student placements all kind of line up with that very foundational document. So as I mentioned, we've come up with 10 EPAs for clinical placements during the program, and we're going to go through each one of those one by one and give you an idea of what those tangible, very observable things are that we're hoping you're going to have students complete and that you're going to rate them on during their clinical placement. So the first is completing a comprehensive physiotherapy assessment. We have been running a pilot of this, this new tool, the PEPAA tool, and some of the questions that came back on this particular EPA is, well, what happens if I'm not doing reassessments that frequently, or assessments that frequently, excuse me. So one of the pieces of feedback we're hoping to provide to clinicians about this is that comprehensive reassessments can also be evaluated under this EPA. So you may have been treating somebody for a number of weeks, and then when you're coming back and they're having a reassessment done, if that student is participating in and completing that reassessment of that client, that can be evaluated through this EPA as well. The second is formulating and communicating a physiotherapy diagnosis and prognosis. And again, we had some questions from clinicians about this, particularly in contexts where a patient may come to the physiotherapist already having a diagnosis. So we're thinking like in acute care context or in some rehabilitation context, the patient might already have that diagnosis. But when we're thinking about that type of patient population, I really want you to think more broadly and come up with a PT diagnosis. And that, when we think about it, is really identification and prioritization of a problem list. And so if you are in one of those contexts where patients are coming in with a diagnosis and prognosis, if the student's working through developing a PT diagnosis with a problem list and prioritizing that problem list, that can be captured under this EPA number 2. EPA number 3 is collaborate with the client to identify and prioritize physiotherapy goals. And I think that transcends pretty much every clinical context. Number 4, develop and implement a comprehensive physiotherapy management plan. Number 5, document all aspects of physiotherapy encounters. So this is where we would be capturing information about, how are they doing in terms of their SOAP or their DARP note documentation, their new assessment documentation. All of that would be captured here. Number 6 is monitor outcomes of the physiotherapy management plan and respond appropriately. So that's things like, when you've given a patient a management plan, does it need to be altered? Does it need to be changed based on change in status of that client? This is also where you might want to capture some information about management of a caseload and prioritization of a caseload, as well as the individual management plan for individual clients. The 7th EPA is plan for transitions in care, plan for and complete transitions in care. And again, we got a few questions about this particular EPA, depending on the context of the therapist we're working in. And completing transitions of care does not necessarily mean that you have to be discharging a patient. It could connect to referral to another healthcare professional, a move to a different level of care within the same institution. So it's important to interpret these EPAs a bit more broadly as they relate to your particular context. And there's nothing wrong with that. So just thinking about, again, transitions in care doesn't necessarily have to mean discharge, but just changes in level of assessment treatment that's required for that individual, and even referral out beyond physiotherapy care. EPA number 8 is collaborate to provide interprofessional care as a member of a health team. And when, again, interpreting this EPA more broadly than thinking about needing to have a very dedicated, specific interprofessional team at your clinical site, that can include collaboration with administrative staff, family members, family physicians that you might be writing back and forth and communicating with them about a particular client, and other external allied health professionals. So again, it doesn't have to necessarily be that we have an interprofessional team on site, but more thinking broadly about who are you communicating back and forth with. For example, surgeons, registered massage therapists when you're co-treating patients. There's all sorts of physiotherapy assistants. There's all sorts of people that you can include in this collaborative care plan. EPA number 9 is using feedback and self-reflection to improve practice. And EPA number 10 is educating other health professionals. And many of our students, when they're out on clinical placement, do some form of a project. So that might be a presentation or a case history, but it might also include, and you can think about evaluating students' ability when they're writing notes back to referring practitioners with new information, if they're participating in rounds, if they're participating in family meetings. The list can go on and on. So just thinking about, again, it doesn't have to be a specific presentation in terms of education, but can be interpreted more broadly than that. As I mentioned right at the beginning, each EPA has a number of sub-competencies which contribute to the observed behavior. So those sub-competencies can be used as a guide for what kind of behaviors you might be looking for, the student might need to demonstrate in order to achieve that EPA successfully. So for example, in formulating and communicating a diagnosis and prognosis, a student would have to do a number of things in order to be effective, including coming up with the diagnosis, communicating clearly, and potentially adapting their communication. And so just thinking about when you're looking at this, this is used really as a guide for you in terms of what are some of the things that I might be looking for and giving feedback about when I'm evaluating this EPA. You'll see as we get into the form, you are able to identify each one of these particular competencies as either an area of strength or an area needing improvement, but I'll highlight that these are not mandatory to complete. So if a student's just kind of ticking along as expected and it's not an area of strength or not an area needing improvement, you don't have to indicate anything. It just gives you an opportunity to do that if you want to just use a click box to give a little bit of additional feedback to the student. So in terms of the rating scale, we've altered it. So you may be familiar again with the ACP, where we go from beginner to entry to practice. A lot of people we've spoken with found that sometimes a little bit difficult to navigate in terms of, well, what does that tangibly mean? We do have anchor descriptors of what it means. But what we've hoped to do with this new scale that we're introducing is, again, make it very observable for you as the therapist. So the scale runs from I had to do it, as in I'm the supervising therapist, and the student was really just a fly on the wall observing me complete this task. I had to talk them through. So if a student's participating in initial assessment, for example, you had to talk them through many steps and provide a lot of cueing to get them to complete that task. I needed to prompt. It's just here and there that you needed to give them a little bit of advice or suggestions, but generally they were flowing through the task reasonably well, needing just a couple of reminders or prompts not to forget certain elements or to include something. I needed to be there just in case, is that although you're present and you're able to be engaged in the care, the student is really at that point going from start to finish and doing a reasonable job. It may not be exactly what you would have done, and it may not be at the level that a senior seasoned therapist might be, but they were doing safe, effective, whatever it is, task that they were tasked with to do. And so you really didn't need to be there. You might still give some suggestions, but they would have got to a reasonable approach to care even if you hadn't been present. And finally, I didn't need to be there at all. This is the rating scale we're asking you to grade each of the EPAs on during the clinical placement. For junior level placements, as you can imagine, they're going to need more support and more of your time and energy in terms of getting them to do the EPA effectively. And so we are expecting those students to perform at the I had to talk them through level, and that would be considered still a successful placement in our mind. Once they get to their intermediate level or their third and fourth clinical placement, we would expect the students to be performing at the I needed to prompt level at a minimum. And again, that's a situation where you would just be giving them suggestions, little cues, things they may have forgotten and need to go back in and perform or ask the client. And then finally, when they get to their final clinical placement, I needed to be there just in case would be the expected level of performance. So we would hope that by that senior level, when they're about to go and work and become independent practitioners, that again, they may not be performing at the same level as you as a seasoned therapist, but that you really could let them independently do many of the tasks that are required of them in those EPAs fairly independently. So how many of these EPAs need to be completed? As I mentioned, they're quick and small assessments, but we want them completed throughout the placement. And so there are 10 EPAs, and we hope that each EPA will be evaluated at least 3 times at the expected level of performance. So that means that over a 30-day or a 35-day placement, there would be about 5 of those a week being completed. So those would be spread out through the course of the placement. So there may be some that get completed in week 1, and then another group of them in week 2. I will mention that one patient interaction can result in multiple EPA evaluations. So if somebody, for example, you have a student completing a physiotherapy assessment, you may be able to complete an evaluation of EPA 1, which is completing a comprehensive physiotherapy assessment. You may also be able to complete EPA 2 and evaluate it, which is formulating the diagnosis and prognosis. And you could also, for example, complete EPA 5, documenting all aspects of physiotherapy encounters, just based on that one patient interaction. And so you can see how quickly you can accumulate some of these EPAs over time. So many of you, again, will be familiar with Elentra as a platform. It is the platform that we're currently using for the stats program when students are recording their daily stats about how many hours they've completed a placement experience and the different types of activities they've been involved in. We're using the same platform for the EPA assessments. It's slightly different in terms of how the placements the evaluations get started, but you'll see there's actually quite a bit of overlap in terms of your end and when you're receiving this information, what that looks like. Very similar to what it's like for your stats approval. I will note, and this is already, again, the same thing with Elentra, just generally for the stats, it works best with Google Chrome or Safari or Firefox or even Edge. Elentra is not compatible with Internet Explorer because it's no longer supported by Microsoft, and Elentra doesn't function with it. So if you're running into a little bit of a barrier accessing the information, it may be because your default browser still is set to Internet Explorer. We hope that that's going to be eliminated as a problem shortly, because it's been many years since Microsoft hasn't supported Internet Explorer, but there are still a few sites that have that as a default browser. So how do these EPAs get started, and who's responsible for what in terms of evaluation? There are really 2 different ways that EPA evaluations can be initiated. The first and the most common way that they'll be initiated is that the student will request that you complete an EPA evaluation on them, and they actually get it started. And so I'll walk you through what that looks like in a moment. We do have adult learners in our program, and we want to make sure that we're treating them that way and really giving them the accountability for their own evaluations during clinical placement. That being said, there is an opportunity for you as a clinical instructor to decide to initiate an EPA evaluation yourself, and I'll show you both ways to do that. I will kind of highlight here that it is important to look ahead, and students will encourage to do this as well, to look ahead in their placement schedule and do a little bit of pre-planning on initiating EPA assessments for upcoming encounters with clients. So if they know, for example, that they have a new assessment coming, they could already prime that pump and just say, hey, I have a new assessment coming. Is it okay if you evaluate me on this for EPA number 1 and 5, for example. And so they could pre-plan that with you ahead of time to make sure that they're getting enough. We don't have a really rigid schedule in terms of it must be this number. We have a lot of flexibility between you and the student and the clinical site and what makes sense for your work week in terms of when and how these evaluations are being initiated. But we do recommend that students look ahead in their placement schedule to do a little bit of planning. And it's okay if it happens at the last minute that there's a change, or after the fact that you and the student decide that that was a good skill that you wanted to evaluate. And so you can initiate them after the fact, but it's nice to do a little bit of planning ahead. So very similar to how you receive stats approvals right now for students. If a student initiates an assessment of an EPA, you're going to receive an email. And it looks something like this. It will have the student's name and say something like action required, and you have a new assessment or evaluation task. And when you open that, there will be a link within the email that you can click on, and that will open the evaluation form of that particular EPA. So when you click on the link, it will open something that looks like this. It will have the EPA at the top. So for example, EPA 1, complete a comprehensive physiotherapy assessment. It will have your name as the assessor and the student's name as the target and who you're assessing. The students will have, because they're initiating it in most cases, they should have completed all of the basic demographic information at the top of the form already. And so that's going to make it a lot easier and quicker for you to complete the assessment. We anticipate these will take 2 or 3 minutes to complete at most. You may see, though, that the student also adds in an additional context cue, and there will be no specific patient identifiers, but it's just going to help you as a reminder about which encounter, which intervention, which documentation it was that you're doing this evaluation on. So they might put something like patient number 1 on October 4th, they were 2 days post-stroke and it was an initial assessment. And that might help cue you to say, oh yeah, right, that's the one I watched, that initial assessment. So the students will have completed all of this demographic information ahead of time. So their stage of learning, the date of the encounter, what type of setting they're in, whether it be acute care, rehab, long-term care, the primary condition of the client that the EPA was being evaluated on, the complexity, and like I mentioned, that additional context cue. You do have the capacity to edit any of this yourself, but the student should have completed this before they send you the form, and you'll open the link in the email, and this will already all be completed for you. So once you scroll down past those demographic information pages, you'll get to the overall rating scale. And it will be familiar, hopefully, from what I just described before. You'll have radio buttons where you are going to be rating the student on that particular EPA on that scale of I had to do it all to I didn't even need to be there at all. This is the really critical part of your feedback to the program about the evaluation of this EPA. This is where it's really driving us to say the student's on track or the student's not on track. The competencies and comments that are below are informational for the student and the program, but they actually don't contribute to the overall grading. So this scale is really important when you're rating them from that I had to do to I didn't need to be there at all for that EPA. As I mentioned, each one will have an opportunity for comments and for competency assessment as an area for improvement or area of strength. These are not mandatory, so you'll still be able to submit the form even if you put nothing in here. But if you do, in a very quick and easy way, want to give the students some feedback to say, you need to work on your clarity of communication, you could just put that as quickly as an area for improvement. It also may guide some of the comments you decide to type in below. Again, comments aren't mandatory, but they're very welcome because it makes it easier for students to improve and understand what it is that you need to work on for the next time. So there'll be a comment box, and again, it's free text where you can just say anything that you want in terms of, like, you know, you need to make better eye contact or whatever it might be, giving the feedback to the student. You also have the opportunity to flag if you observe any safety or professionalism concerns during an encounter. And if you do, the default is no with this. If you click yes, that there was a safety concern or a professionalism concern with the encounter, that will trigger an email to the Queen's faculty, myself or Randy, and so we'll get notified that there was an issue, which will reach us, result in us reaching out, or a prompt for us to reach out just to check in and see how things are going. At the very bottom, after all of that, you submit. You can save it as a draft if you choose, and it just means you might want to come back and answer, you know, put in a bit more text or something later. But otherwise, you would just press submit, and you'd get that green successfully completed notification, and that's it. That's the assessment of a PEPAA. Option number 2 is that if you choose to initiate an EPA evaluation yourself as the clinical instructor, so you've decided that you would like to give the students some feedback about a particular interaction. They haven't reached out or they haven't initiated it, but you really wanted to give them some very documented and very specific feedback. You could also choose to do that yourself. And what that requires is you logging into Elentra. So we will be sending you the link to the Elentra platform, and you should receive login information. And you would log into Elentra. On your dashboard, which I'll show you in a moment, there's a green Start Assessment button. So you'll log into the page and you'll see this green Start Assessment button, and you would click onto that. You need to choose a few pieces of information. For example, what student is it that you're evaluating, the date of the encounter, which placement level it's connected to, whether it's their first placement or their 5th placement. And then you need to select which EPA you're hoping to evaluate. And then you press the Begin Assessment button. So there's a few steps for you to do to get that going. But once you do it once or twice, it's actually quite straightforward and simple for you to navigate your way through. And I'll show it to you kind of real time in a moment. The only difference there is that it would pop up the blank form, and you would be filling in that demographic information at the top because the student wouldn't have done that for you. But the rating scale, the competencies, and the comments below all remain exactly the same. You would press submit. The students immediately, as soon as you press submit, the students, I believe actually by the next day, will get access to all of your feedback and comments. They'll see that you've completed an EPA evaluation on them, and they're able to access that through their Elentra platform. And so they very quickly will be able to get that feedback. As I mentioned a little bit earlier, I think a couple things to note. Beginning of each week, consider planning out the week's EPAs in your encounter schedule. We can really leave a lot of that to the student, but you can be, you can contribute to that conversation as well. Be mindful of trying to evenly space out EPAs. Again, we don't have a prescribed schedule for these, but if we have a 6 or 7 week placement, you want to kind of imagine, you don't want to leave all of these for the end. And so just thinking about how you might pace those across time and make sure that you're getting a few of them, like 5 or so completed each week, would be a good target. And making note of using feedback and learning moments to improve practice. So students will be hopefully driven to review the feedback you've provided and improve their practice based on what they have access to. I'm going to actually just stop there and show you actually what this would look like. So just bear with me for a moment as I open a few different things. So while I'm here, so I've just logged into Elentra, imagining I'm a supervising therapist. So I've logged in, and this is the page that it takes me to once I log in. As I mentioned before, we have that Start Assessment button. So that's what you would initiate. You would start the assessment and click on that to access it. We're evaluating EPAs. We would leave it like that. This is where I would type in the student's name. So in this case, I'll do PT test student. so we won't really evaluate a student. I would select the date of the encounter. I would choose the course and so the clinical placement 1, for example, that were the students on. And then I would choose which EPA I wanted to evaluate. So let's say I'm going to evaluate EPA 2, formulating and communicating a physiotherapy diagnosis. I would click on that and begin the assessment. And like I mentioned, it pulls up that form so I can see which EPA at the top that I'm evaluating. It shows me as the assessor and the student that's being evaluated. It would have their information there. The stage of learning is just where they are in our academic program. So foundations is the first 2 placements. Core is, foundations is the first placement, core is the second placement, and transitions are all the placements after that. So we'll send those details for you. So you have that. You put the date, the setting type, primary condition, complexity of the situation you were dealing with, and then you get down into your observation. So you could click on any one of these buttons depending on how you thought the student performed. And here, these are the competencies associated with this EPA. Again, not mandatory for you to select any of them as an area for improvement or area of strength, but if it's something you would like to very specifically give to the student as feedback, you know, that they needed to work, for example, on adapting their communication approach to the context, you might select that one as something you want to give feedback on as an area for improvement. Here you have an opportunity to type in anything about strengths or areas for improvement for feedback, text-based feedback for the student. If you have any safety concerns, like I mentioned, it defaults to no, but if you decide that yes, you do have a safety concern, you would click yes. And that would prompt Randy or I to reach out and, you know, have a little bit more of a conversation. And then at the bottom, you would just submit. And so that's the evaluation. As you can see, it could be very, very quick to do. And that's if you're doing the heavy lifting and actually initiating it yourself. If the student had initiated the assessment, you would get an email that looks like this. So I've just opened the email. It said action required, new assessment task or evaluation task, and it has the student's name. And I would click on the link in the body of the email. So I would click on that link and it should open the assessment form. As I mentioned, the nice thing with this one is that the student will have done a little bit of that demographic work at the beginning. So EPA 3, collaborate with a client to identify and prioritize physiotherapy goals. That's the one where the student has asked us to evaluate. They've already completed the demographic information here. You have the ability to edit if you want, and they may have added some additional context where they just kind of cue you or remind you which patient it is or which encounter it is that you're talking about without any specific patient identifiers. Your job in this case is to complete this as the mandatory portion, the overall observation of that EPA. If you so choose, you can evaluate any of the competencies below or give some feedback on that. And then if you choose again, ideally we'd like to have as much text-based feedback as possible so the student really can get that information and learn from it. So you can type in areas for strength, areas for improvement, and submit. So very similar, but again, like I said, it just comes in an email format. So hopefully that looks fairly straightforward. Everything when it's new, we know it takes a little bit of getting used to, and change can be a bit tricky. Randy and I are here as supports if there are things that are unclear, things that go wrong, but certainly, you know, we've been testing it through the pilot phase and things are generally going well, and the feedback we've received so far has been quite positive in that clinicians are saying, I already do this kind of feedback anyway, now I'm just documenting it quickly. And they like the students getting this feedback automatically and the students having some responsibility for tracking their own evaluations and starting those. We put a couple of FAQs here just based on some of the things that, you know, we thought maybe clinicians would have questions about, or during the pilot, a few of the things that have come up. So we'll just kind of go through these one by one, and but also open it for questions, because I'm sure there will be other things here that we haven't gone over that you may have questions about. So I'll just go through these first ones and then open it up for some questions afterwards. Oops, sorry. So what if I evaluate a student with simple conditions 3 times at the expected level, but then subsequently I notice they can't meet that same EPA with more complex scenarios, or they later just don't do as well on the EPAs or regress for whatever reason? Like, what should you do? I would say in this case, this is a circumstance where you will likely want to trigger additional EPA evaluations, and you may need to do that yourself if the student's not choosing to do that. And so you may end up with more than 3 EPA evaluations. You may have 4 or 5, and some of them may be lower. It is also a good time to reach out to Randy and I if you're saying, ooh, like we thought things were good, but now they're not looking so good. That would be a good time to reach out to Randy and I and just say, you know, this is the trajectory. This is what's going on. What do you think we should do? We can talk through some of that together. We don't anticipate that being a really common scenario. However, if it does come up, again, reach out is the main message there. And also that you can do additional EPA evaluations. Similarly, a question came up about whether you need to evaluate EPAs with more complex cases for senior level students. And the answer is what we would hope you would do and what the students would be doing is taking your caseload and having a representative mix of that caseload in the EPA evaluations. And so included in that, in the 30 plus EPA evaluations, some of those will be more complex and some of them will be more straightforward cases. There is no requirement specifically to have a certain number of quote unquote complex cases at the moment. But really what we just want is a good representation of your specific caseload. Is there a specific number of EPA assessments that should be completed at the beginning versus the end of the placement? I think we kind of addressed this, just saying it's ideal to make a little bit of a game plan each week of which EPAs and how many times we're going to evaluate. But this is really designed and with intent to be quite flexible, to fit around your practice approach, your caseload, your specific working context. There isn't a specific number of EPAs that need to be done at the beginning versus the end. It's really trying to spread them out throughout the placement as much as possible, just to make it easier for everybody, but really trying to be as flexible as possible to really fit with your workflow. But on the heels of that question is, what happens if a student doesn't initiate enough EPA assessments to meet the minimum number? And what happens if they leave too many assessments to complete in the final 1 or 2 weeks? What do you have as a responsibility to make sure they get it all done? And as I said at the beginning, we have adult learners and we want them to have a lot of responsibility to complete these assessments and make sure that they are independently tracking to get enough of those done. And so trying to take some of that onus and responsibility off you as this clinical supervisor and really have the students take that initiative themselves. If you are feeling that the student is at risk and it's unreasonable that they complete the number of placements in the final week, for example, that are outstanding, please do reach out to us or direct the student to reach out to Randy and I. Again, we'll be really emphasizing this and stressing this with the students, that they should be having these like kind of evenly spaced throughout the placement as much as possible. So we don't anticipate this being a huge problem. But, you know, from time to time, we may run into a scenario where our students just left too many for the end, and we'll have to navigate together how to approach that, so it doesn't feel that you feel responsible yourself as a clinician to do, you know, 15 EPA assessments in 4 days. A question came up during, oh, sorry, go ahead, Randy.
Oh, no, I was just going to direct to the chat.
Okay. So go ahead, sorry, Randy, if you want to read out any of the chat.
Yeah, so Lisa had a question just regards to filling out the evaluations in terms of having to be at a computer to document an evaluation. And will you need to check email maybe more frequently during the day? Will students be carrying laptops, and how does that look?
Yeah, so it's going to look a little bit different depending on each clinical scenario. So we know that there are some clinical sites where they're doing electronic documentation real time with clients in front of them. So it's really easy for them to be accessing this EPA form concurrently. And if that's your clinical situation, absolutely, you can do it real time as you're watching the student perform an EPA or a task. And that there's nothing wrong with that. It may be that you complete it after the fact, or when you're sitting down and doing your documentation, and that's why that cue, that reminder about which interaction you're talking about is important, that the student's including a little bit of detail to remind you, oh yeah, right, it was that one that we were talking about. And so you can do it when you sit down at a computer, so it could be end of day or whenever. And you'd have access to that. They do come through fairly quickly. So if a student initiates an EPA assessment, you would probably have access to that within, I think I did one and it came within a couple of minutes. And so you could potentially have access to it very quickly, or they could be sitting there waiting for you in your inbox and your email end of day when you're doing your documentation, and you can complete it then. They don't disappear if you don't do it that day. It's not like anything goes away. It does make it a little harder if you leave them for a really long time to remember the feedback that you wanted to provide and how the student performed. So we do encourage clinicians to, within reason, stay on top of those. But it could be real time, anything from real time documentation all the way to I'm going to do this tomorrow or the day after when I sit down and have a little bit of time. So there's not really a need to have the students A, carrying laptops, or B, you feel like you have to be checking your email all the time. It's really dependent on your workflow and how you operate, what works best for you.
Yeah, before we go to the next question, there's another question about whether this can be done on the phone. I just thought it would be more relevant to what we were just talking about. So could we do this on a phone or tablet?
It is possible to do it on a smartphone or a tablet. I would say that it just, sometimes it's a little bit not, it's fine to do it that way, and there's nothing wrong with it. I have done that myself. It's a little bit clunky trying to type in and click all the radio buttons, but it's definitely possible. And yeah, certainly if that's the easiest thing for you to have on you and it feels not too intrusive in the flow of the patient care to do that, then absolutely you can do that.
And Bhumi had a question about if you're able to trigger more than one EPA at any given interaction, or do they have to be done one at a time?
Yeah, that's a great question. So you do need to initiate one EPA at a time. So you would log in, press that green initiate a start assessment button, and choose one particular EPA. But the process, you wouldn't need to re-log in. Once you press submit, you could press that green initiate assessment button again and go through that same process. So it is a little bit more labor intensive, but it's still fairly quick once you've logged into Elentra. Okay, so keep those questions coming. This is really helpful for everybody. I'll just talk about caseload volume and just what that looks like with the EPA assessments. I know it's something we've really, I'm going to say we've struggled with our placements over time. Clinicians feeling the pressure, I'm going to call it the pressure, to hand over a portion of their caseload, particularly to senior level students. And if they didn't meet that threshold of the percent of caseload, that could they actually pass the placement? Were they successful in the placement? And we've kind of stepped away a little bit from that caseload volume question. But what I would say is that we still have an expectation that as students move through clinical placements, that when they're more junior, that they would have less responsibility in terms of the amount of patients that they would be interacting with. And as they become more senior level students, that you would give them more and more autonomy. That's not really captured in any of the EPAs, and there's no firm percent that you need to give them, but you will be evaluating EPAs of students in senior placements who you have allocated more caseload volume to. And so they are still needing to perform those EPAs with a greater caseload volume and greater autonomy. And so you're effectively evaluating their ability to do that. But we're not dictating, saying you absolutely need to have 75% of a caseload independently, otherwise you can't complete this placement. And so we're kind of in a bit of a middle ground with that. And finally, I'll just mention a question that's come forward from the pilot is there a place where I, as the CI clinical instructor, can see how many EPA evaluations I've completed on a student? There is a kind of roundabout way where you can look at that, and I can show you what that looks like. But I will say one of the things that Randy and I have determined is a good approach based on some feedback from clinicians is when you get your placement match, one of the documents that will come with the email with all the details for your placement is just a tracking sheet. And so although it won't be digital, you'll have an option. Sometimes people like that. They just have they can print it out and do paper or do it virtually and just have a sheet where you can track yourself. You yourself don't have a dashboard like the students do to view the number, the count, the rolling count of evaluations they've done, but you could do it on the tracking sheet that we send you. You can certainly ask the student for them to confirm with you. And I can just show you a little bit of a roundabout way to go in and see that as well. So if I'm just going to go back into Elentra. So if I'm in Elentra, I can actually go to my assessments and evaluations tab, which is this bulleted list up at the top right-hand corner. And if you click on that and you are going to access it, it will take you to your assessments and evaluations. And you can go to my completed tasks, for example. And what that's going to do is just bring up all of these different forms that you've completed. That will include all your stats forms that you completed. So like I said, it's not like the most user-friendly way to find it, but if you want to look back and find an EPA assessment that you've completed, you're able to do that and access things that way.
We had another question about whether students will still be coming to placement with specific learning goals.
So the short answer is yes, absolutely. They'll still come with their own learning goals, things that they want to be working towards and improving upon based on previous feedback, that things that are specific to your caseload and patient population. So absolutely, they'll still come with their own specific learning goals. They would still have some expectation that they would do some form of a project, whether it be a blog entry, a formal presentation, a case study, something like that. All of those still remain true. I just want to highlight, I mentioned that we're still going to be doing ACP evaluations and PEPAAs. So just as a reminder, the PEPAAs are throughout the placement in approximately 5 a week. The ACPs now is the final only, so around week 6 or 7. And I don't want to end on an unhappy note, but I also just wanted to highlight that there is, if you have serious concerns about professional conduct of a student, and that's like outside of during a patient interaction, but things like if they just come late every day, for example, late every day to placement, we hope is really rare occurrence. We actually have a specific form for you to use. This was based on feedback from clinicians as well, that they just wanted to have a mechanism to flag some of this. I mean, you can always just reach out to Randy and I and send us an email if there is anything, but just wanted to highlight that there's a specific form that that you can use to called the Global Professionalism Behavior Form. And so it's possible to access that as well. It describes here how to do that. You do that Start Assessment button. You actually click on Other Assessment Form instead of Entrustable Professional Activities. And you would just select the name of the student. And then there's something called Global Professionalism Behavior Form. You would complete that and begin that assessment, document the concern, and that would flag something to Randy and I as well. So again, don't want to end on an unhappy note. So overall, again, we're really excited about these PEPAA evaluations. We hope that we have a fairly smooth transition to them. Like I mentioned, we've been piloting this with groups of students and clinicians since January, and overall have received quite positive feedback. Really appreciated the feedback we got to help clarify some of the EPAs. And yeah, we'll just keep it open for questions if there's anything anyone wants to go through now. If not, just wanted to send a quick plug and reminder that we will be running sessions again. If you're not able to join Randy and I when we did an overview of the new curriculum and the impact on clinical placements, there will be another version of that available on Tuesday, October 10th at noon. We will be recording the sessions and posting them as well. So if you aren't able to make it, no problem. But sometimes it's nice to be able to pose questions and kind of hear it live. And then for this session, and you've already participated, but if any of your colleagues want to participate as well, we are having another version of this offered again on Monday, October 16th at noon. So feel free to join again if a question pops up in your mind, or like I said, spread the word as well. We have these additional sessions coming up. And a huge thanks to you for spending this time with us and going through this, and feel free to reach out at any point with any additional questions. Thanks, everyone.